So Elizabeth, perhaps you tell us a little bit about your background.
So I started my training in 1980 and I was clinical, being a night sister and a ward sister, until 1992 when I went into management. And from then, in 2000, I became head of healthcare at a high security prison. From that, I went into prison inspection and became the first nurse to hold the post of head of health inspection for Her Majesty's Inspectorate of Prisons. So then a natural step in 2014 was from inspection into regulation, and I now work for the General Medical Council.
Lovely. And perhaps you could tell us why you've chosen to return to nursing now.
Once a nurse, always a nurse. And so when I realised that Ashford and St Peter's and many other trusts would need more staff, I asked the General Medical Council if they would release me so that I could come and do some clinical work.
And how are you finding being back?
I'm not an ITU nurse, but that's where I've ended up working. And actually, working with a nursing team and a multidisciplinary team is really good. The situation we find ourselves in is really scary, but the team make it easier.
Okay, and why would you encourage other ex-NHS staff to return at the moment?
Because we've got skills, they've got skills that are vitally needed. We can do some of the things that nurses that I'm working with, most of whom weren't born when I started my training, they've got the technical knowledge, but I know how to do eye care, mouth care, turn a patient, hold a patient's hand. I can do that, and that's what's needed.
And anything else you want to add?
Actually, Ashford and St Peter's Trust have been really welcoming. They've fast-tracked my honorary contract, and the team on ITU have been so welcoming that it's actually been quite a pleasure to be able to come back.
Okay, Kim. Firstly, just start giving us a bit about your NHS background.
So I trained in the 1980s, very much like Elizabeth. I trained in Birmingham. I went and worked in intensive care after I trained and was a sister actually in a local hospital to here, St Heliers in Carshalton. I then became a nurse teacher for a long time, 22 years, and loved that job, and then now work for the General Medical Council teaching doctors.
So why now? Why choose to return to nursing now?
Last year I'd already decided that I really wanted to get back to nursing, so fortunately actually I joined the nurse bank here at Ashford and St Peter's and was working a couple of days a month on the endoscopy unit. As soon as the GMC allowed us to be released from our roles, I phoned up the intensive care unit and they were lovely. They welcomed me with open arms.
And how are you finding it being back in ITU?
So there's some things that are very different. So the ventilators look very different, the pumps are very different, but actually the essential parts of nursing care, which for me are the most important parts, the way you talk to patients, like Elizabeth said, eye and mouth care, washing patients, turning patients, making them comfortable, and supporting the rest of the team, actually, those are the things that are really important. And they're just the same. They're exactly the same as they were 25 years ago.
So why would you encourage other ex-NHS staff to return?
Once a nurse, always a nurse. And I think that it's really important to be able to support our colleagues at this difficult time if you can. I don't think people should feel guilty if they can't. But if you can, then it's certainly extremely worthwhile and a real privilege to be here amongst the multidisciplinary team, providing care for patients.
Anything else you want to say?
So I'd like to thank the General Medical Council for releasing me from my role and for my colleagues for covering my parts of my role that I can't now do. It's been an amazing, as I said, privilege to be here and be part of the team.